pain and there's deformity, you can now do what you call arthroplasty, total joint replacement, which is trying to put an artificial joint together. You replace the surface of the bones forming the joint, and then you see the pain is removed, stability is maintained, and the patient is happy.
Okay, let's take this call. Hello.
Hello.
Hello. Samuel, are you there?
I'm there.
What's your question?
I just want to find out from the doctor, is there any difference between the osteoarthritis and spondylosis?
Okay.
Yeah.
Thank you, Samuel.
Well, I guess I spoke about this. When you use the word spondylosis, you are dealing with an arthritic condition of the spine. So in the peripheral joints, you use the word osteoarthritis.
But
so
when it's the spine?
Spine is spondylosis.
Okay.
Just a simple distinction.
And is it the same thing that happens there? Stiffness?
Yes, but you see, you are
loss of cartilage?
Stiffness, you have pain. Yes, loss of cartilage. But don't forget that the cartilage or what is between the vertebral bodies in terms of the spine is a disc.
Okay, yes.
It's a disc. So you have a situation where the disc can prolapse into the surrounding tissue and cause some tension on the nerve.
Is that what they call a slip disc?
Exactly. That's a different thing entirely.
Okay, and that could result from arthritis in the spine?
No, in the process, what now happens is that that will affect the two, in between a bone and the bone below is a disc.
Just a minute,
yes.
Doctor. They are really calling in now. Hello, who is there?
This is George. I'm calling from Focadis area.
You are welcome, George. What's your question?
Yeah, my question is this, because I have a problem with I have some problem with the fingers. Like just you explained that it's one of the effects of this arthritis of a thing. But I've been listening to see if you offer a solution on how to get rid of that problem. Because like my mother is currently having the kind of pain on her knees and wrist, although she's old. So that's what we do tell her, that she should not be feeling that something else that is responsible. So I'm happy with what she has said in respect of that, to manage. But getting rid of that of the finger for young people of maybe 50 or so, or something of that nature.
Okay, George, I get your point.
So I know how to manage.
Thank you so much, George. So, Doctor,
yeah, well,
George feels he's 50 and young.
Yes.
He wants to get rid of the stiffness in his fingers.
Well, I don't know what may have caused that, because I can't say on air that that's as a result of osteoarthritis, because so many conditions can lead to swelling around the hand. Have you had an injury to that hand before? Or even if you're 50 and you're having such situations, is it as a result of the fact that it may not necessarily be osteoarthritis? It may be, I don't know, because, so what I would advise really is for him to visit the nearest general hospital, central hospital.
At least know the condition
exactly.
that he
and
has.
see an orthopedic surgeon who would ask questions, do x-rays, and maybe do some lab work. And then with all the things put together, you'll be able to arrive at a diagnosis.
But let's just suppose, let's just suppose that it is osteoarthritis.
Yes.
Is the end result a replacement? Do they do replacement for the fingers too?
Yes. You can do replacement of the fingers. You can, if you cannot do that, you can fuse the finger. The only thing is that
lock the bones together.
Yeah, you just excise the cartilage that's remaining, and then you bring the two raw ends of bone together, and then you clamp them together, and then fuse this in that position.
Wouldn't that be painful?
No, painful when the surgery is done, but once there's healing between bone and bone, it's called arthrodesis. That is fusion. Okay. And in that situation, the only thing you lose is the
ability
movement.
To bend it.
You bend, but this other one will stick together. It will stick out like that. But the pain is eradicated. I wouldn't say, but in the present or what you call medicine has gone so far that every little joint of the hand can be replaced. But in our environment, the simplest solution is what I've just preferred, and that's for an end stage where you have so much pain, and it has led to loss of, maybe you can work, or it's life threatening. I mean, you can't work,
it's
and then
debilitating.
Exactly. So
you now recommend the fusion then?
Not for every joint.
Okay.
I just said
no, but I'm just thinking, fused fingers. Yes. There will be loss of mobility.
Yes.
Fused joints, okay,
Yeah.
not fused fingers. There'll be loss of mobility there.
But,
how does the person handle things, carry things?
You are supposed to assess each patient based on what they have. I was just mentioning for one, maybe joint that's affected, but where you have a situation where it's affecting several fingers, then you need to be very careful. You need to ask yourself, is this the dominant hand?
Okay.
What work does this person do? There are several things you need to put into consideration before you, and that's an extreme.
But a person can live a pain-free life at the end of the day. Thank you so much for coming, Doctor. That was so nice, and thanks for taking time out of your busy schedule.
Yes, welcome.
Thank you for being with us. And thanks for calling. Samuel, George, I appreciate your calls. Have a lovely day.